Sleep is actually not my passion. So started with the primary care, took care of patients in the hospital, ICU, got burned out, got into the weight management. There was no good reimbursement, got into sleep, and sleep been working very good. So I'm going to start with the biology of the sleep. What really defines healthy sleep? So all of us, we sleep, but what is a really good and healthy sleep? So a sleep that has a good duration, and we'll talk about what is a good duration for the sleep, and the appropriate timing, and patients who have regular sleep and absence of the sleep disorders with a good quality. So all of us, we're going to look into these big factors. Duration, we're going to look at the right timing, it should be regular, it should be of good quality, and absence of the sleep disorders. Now, what is sleep? Right? So I ask my residents, my students, what is sleep? I mean, we close our eyes. What really happens? It's a complex, reversible state of being, right? This is a function of the brain, for the brain, by the brain. So this sleep happens in the brain, nowhere else. The definition of democracy is a government, the government of the people, for the people, by the people. So I call this is a democracy of the brain. And the modern science actually defines sleep on the basis of both the behavior and the biological criteria. We see the sleep in the other animals, dolphins or bats, the way they sleep. But we humans, we have to negate the gravity, so we have to lay down. All right. And similarly, the functions of the body and the brain are going to be a little different during the sleep rather than the wakefulness. So it's a function of the brain, by the brain means we have dedicated centers for the sleep in the brain. Now those centers are not just one center, they're multiple centers and they are interconnected with each other. And so we have identified the neurotransmitter, those chemicals that are involved in the generation of the sleep and wakefulness. So based upon that, we have these medications to promote sleep or to promote wakefulness. Now, it's a function for the brain because it's going to involve the neuronal growth, the memory, the focus, and also very important concept of removal of the toxins from the brain. So throughout the day when we are awake, we are utilizing the energy molecules, we are using the protein, so they're going to be a breakdown product. Okay? So those breakdown products needs to be removed out of the brain, and that happens during the sleep. So the system is going to be lymphatic flow, right? And we do see that this system is very active during the deep sleep. They did a study on the mice. Now, the folks who do not get enough sleep, they may have these toxins deposited in the brain, and they may have a similar presentation or similar changes like Alzheimer's dementia, people who have memory issues. So what are the other important functions of the sleep? So in addition to the brain, we're going to have our body physical growth, right? So babies, they sleep a lot. So there is going to be a growth hormone released during the sleep that we need for our growth. Similarly, the regulation of our body temperature, immune system, our energy conservation. So the folks who do not sleep enough, who are sleep deprived, they are going to be at high risk of having infections. Upper respiratory infections, especially during the flu season. If the kids are not getting enough sleep, they will be more prone to have infections. So in the brain, we have these two mechanisms called the sleep drive and the wake drive, or the circadian drive. So when we are awake, we utilize the energy molecule called ATP. It's broken down into adenosine. Now this adenosine actually is responsible to have a drive with which we sleep, and we need that. Right? So people who actually have multiple naps, or they drink caffeine, or they take certain chemicals that are going to impact their sleep. So their sleep drive is going to be poor, and they're going to have problem with insomnia. The second drive is the circadian drive. That's the force with which we stay awake, and we need that during the daytime. So it is going to be oscillating. It's going to be up and down a little bit, and that determines our wakefulness. So for us to sleep good, we need to have a high sleep drive and a low circadian drive. So if there is any imbalance between these two drives, we're going to have problem with sleep. Right? So some of us are night owls. So we have a high circadian drive at nighttime, and if we try to go to bed early, we're going to have a hard time to sleep. Some of us, we are the morning larks. So in the evening, our circadian drive is really low. It's going to be very hard to be awake, at the dinner time. This is a very busy diagram, but basically on the top, you would see the sleep drive. So as we are awake, our sleep drive is going to be increasing. On the bottom, those arrows are our circadian drive. So which means it's also increasing to combat the sleepiness. Till we hit this sleep window time in which the sleep drive is going to win and we're going to fall asleep. All right? So during the daytime, it's our circadian drive that's keeping us up. And at nighttime is the low circadian drive that's going to keep us asleep. Then we also have our melatonin. Melatonin is a hormone of darkness. So light is going to suppress it. So it only gets produced when we are in the dark. And we need this endogenous melatonin for us to have sleep. And generally, it starts to secrete about 2 hours before we fall asleep. Okay? So what we do at nighttime, we have screen, we have the light, the blue light, that's going to suppress the melatonin. I'm not able to sleep, so I'm on my TV, I'm on my phone, and that's further suppressing the melatonin, which means our sleep gets further delayed. The other thing is our body temperature. So this is the graph for the body temperature, and there is a small dip there. And that's this time is called siesta time. So we have a dip in our body temperature, and most of us, we start to feel a little bit drowsy and sleepy after the lunchtime. So that's the physiology we look into when we're looking into the sleep problems and explain to the patients who suffer from insomnia. Hey, this is the physiology, let's work on that, all right? Let's have less light close to the bedtime so you can have a better and early melatonin. Similarly with body temperature, all right? So analogy is the sun. When the sun comes out, the light comes and it's warmth, right? So similarly, when the night comes, the sun is down, light is gone, and the temperature is also down. And that's what we need to mimic around us at nighttime. So light is very important for the energy, for the alertness, and for the sleep. Sleep and wakefulness is a 24-hour process. Okay? So we need more light in the morning. So at least 250 lux. But as the sun goes down, we do not need too much light. So as you can see in the evening, less than 10 lux. And then at the bedtime, as dark as possible. That generally promotes a healthy sleep. So one would ask, what are the different stages of the sleep? So we assess sleep based upon different parameters. So the polysomnography or the sleep study that we do in our sleep labs, we use the brain activity, eye activity, and muscle activity to stage and score the sleep. So sleep can be divided into a very restful wakefulness when we're just closing our eyes and trying to rest and trying to relax. And then we get into the non-rapid eye movement sleep and rapid eye movement sleep. So 70 to 75% of our sleep is the non-rapid eye movement sleep, out of which this N3, that's what we generally want. Most of us, we want that slow wave sleep, the deep sleep in which growth hormone is created and is most deep and relaxed sleep. 20 to 25% is the rapid eye movement sleep in which we dream and we may remember. So 80% of the dreams happens during that. This sleep actually cycles between the non-REM and REM, and we get almost 4 to 5 cycles, at least 90 minutes. The next slide shows a hypnogram. This is basically a graphical representation of the different sleep stages. As you can see, the patient will start with the wakefulness. After, let's say, a few minutes, would go into the non-REM 1, which is superficial sleep, then would go into the N2, and then N3, which is the deep sleep. The first half of the night, we get the deep sleep, the N3, and the rest half of the night, we get more REM sleep. Generally, we wake up during the REM sleep. So that's another important picture to show to the providers, medical providers, where we can have problem with parasomnias. The kids, they may actually wake up screaming, or they start to sleepwalk, or sleep eating. That generally happens during the first half of the night where we have the slow wave sleep. And in elderly where they start to fight or they are waking up, they're kicking, that happens during the REM sleep. Those are the different abnormal behaviors which we see during the different stages of the sleep. A person who is sleep deprived could also have the deprivation of these sleep stages. And when they actually get that recovery, they're going to have a rebound of these stages. Medications, they can also impact these sleep stages. Depression medications can suppress the REM sleep. The nerve medication like gabapentin can impact our slow wave sleep. So there are going to be impact of medications and health conditions on the sleep stages. These stages, they also changes over the time period. Okay? So when we are young, we really have lots of REM sleep and we have lots of deep sleep, but as we age, we actually have lesser and lesser amount, especially the slow wave sleep reduces when we age. The duration of the sleep, the total requirement of the sleep also changes as we age. So we're going to have less amount of sleep, we're going to have less deeper sleep, and we are going to have more awakening, which are basically a normal physiological response of the brain. Brain is also aging, so sleep is going to be impacted. So the 4 healthy habits that can prevent the chronic health conditions, one of the biggest one is going to be sufficient sleep. In addition to not to smoke and do regular exercise and to keep a healthy weight. So how much sleep generally we need, right? So 17 or I would say 18 and above would need at least 7 hours of sleep. So there is a range, 7 to 9. Some of us would be short sleeper. Okay? So I have a patient who said, doctor, if I sleep more than 6 hours, I feel more tired and sleepy. Then I have, a patient at home, my wife, if she does not get her 8 to 9 hours of sleep, I'm in trouble. So we have long sleeper and short sleepers. But generally it is the 7 hours. But the younger patients, the younger people, they need more sleep. That's 8 hours and above. So according to the CDC, more than 1/3 of Americans don't get enough sleep. So that's really alarming. And most of us, we may not get enough sleep on the weekdays as compared to the weekends or our days off, and we try to catch up. So we have a sleep debt on the weekdays, and we're trying to pay that off on the weekends. So this is another important slide. As you can see that 2/3 of the US teens, they are not getting enough sleep. Teens, they need at least 8 hours of sleep. Okay. So why we don't get enough amount of sleep, right? Mostly it's the lifestyle. Okay. So we are too busy with the work, with the school, with the life, and plus when it's time for our sleep, we are still engaged in the screen time, social activities. So basically, we also sacrifice our sleep. So when I was growing, a successful person is the one who's going to sacrifice the sleep. That's wrong. We should not sacrifice the sleep. We should take care of our sleep so we can have an optimal function of our brain, and we can perform well in exams, in our test, in whatever we're doing the next day. Similarly, we do need people at the odd times. We need the shift worker, graveyard worker, so they're going to have some sleep problems. Health conditions, knee pain, chronic hormonal problems, chronic health conditions, mental health conditions, they're going to have problem with insufficient sleep. Similarly, the chemicals, alcohol, is going to impact our sleep. People, they may drink alcohol to relax and sleep, but unfortunately that suppresses the REM sleep. It comes back and they're going to have a sleep maintenance insomnia. They're going to have, problems with vivid dreams. People, they are smoking, nicotine is going to suppress the adenosine receptors, and that's going to cause the sleep drive problems, and they're going to have insomnia. Okay. And sleep disorders, sleep apnea is underdiagnosed, honestly. Now, not all snoring is sleep apnea, but if someone has snoring and they have trouble sleeping, they feel tired and sleepy, they have a blood pressure problem, they have weight issue, so those need to be screened for the sleep apnea. And we can prevent a heart attack, we can prevent a stroke, we can prevent the accidents. So the sleep deprivation, the insufficient sleep is going to impact from head to toe. Okay? So as we started with sleep as a function of the brain, so our brain is not going to be having a good function. So we're going to have a memory problems, we're going to have a focus issues, we're going to feel very tired, and even the hallucinations can happen. People, they would actually have a mood problems. Okay? It is also going to impair the immune system. Okay? So especially someone who are already immunosuppressed, they are on medications, they have other health conditions, and if they're not taking care of their sleep, their immunity is going to be further decline. It can also increase the risk of diabetes and blood pressure. It can also impact the weight. Now, insufficient sleep can produce more hunger hormone, ghrelin, as compared to the satiety hormone, leptin. So someone who is struggling with the weight, if they would like to lose weight, they really need to take care of their sleep as well. So what are the major causes of the poor sleep? So that's, as a provider, I would actually see every patient with this differential in my mind. I will go with, what health conditions do they have? Okay. What medications do they take? Do they take any chemical or substances that can impact their sleep? And also look into their mental health conditions, if they have underlying depression or anxiety. And what are their sleep-wake cycles, their schedules? And also if they have underlying sleep disorders. So as a sleep doctor, I would actually look into sleep disorders in the end. All right? So the sleep apnea, restless leg syndrome, parasomnias, insomnias, those would be on the bottom, because the big chunk of the other problems are going to cause the poor sleep. So very common, all of us, we have smart devices. We have different applications we use, and definitely that's something, people, they ask me, my Apple Watch, my smart watch is telling me I'm not getting deep sleep. I had a patient who would say, I'm only sleeping 1 hour according to my watch. And I say, do you think you're getting only 1 hour? No, I don't. Right? So what is the statement? What is the statement? The statement of the American Academy of Sleep Medicine is that we cannot use these consumer devices for the diagnosis or the treatment purposes. But we do promote and we do advise, because it is going to increase the awareness. Okay? So the next slide is also very important. So the pro of using the technology for that, it is going to raise the awareness, but look at the cons. It is going to increase anxiety in user already hyper aware of the need for the sleep, right? And it can also be a bedtime distraction, and most of them, they're not validated. Now we are seeing another form of insomnia, orthosomnia, in which these devices becomes the culprit for having insomnia. Okay? So there is a form of insomnia called paradoxical insomnia, in which person can have a misperception of the sleep. I'm only sleeping 2 hours for the past 30 years. Okay? And they believe in that. It's actually very hard. So, the first visit, really look into what's really happening. I'm recording those things. And when we do the sleep study and we do the objective analysis, and they're sleeping 5 or 6 hours. Their sleep is poor for sure, but this misperception can also be augmented by these devices. This is my last slide. So this is basically the main message. For us to sleep healthy, what are the big things which we can do? All right? I always start with get up time, not from bedtime, get up time. Keep one get up time every day. All right? That is going to provide an anchor to the circadian rhythm. Build your sleep backward from there. Go to bed when you are sleepy. Don't go to bed when you're fully awake and alert. Number 3, bed is only for 3 S's: sex, sickness, sleep. All right? I generally don't tell the sickness. Okay? So I say it is only for 2 S: sex and sleep. If a person is not doing these 2 activities, they do not belong to the bed. Okay? Eating, drinking, making phone calls, engaging conversation. This actually saved me. My wife, she said, let's have some talk. It's bedtime. You're not doing sex. That's it. We're going to sleep now. We'll talk in the morning, right? And another important thing is no naps. Now, naps is a little bit tricky. Okay, so nap is a little bit tricky. So there are a little bit mixed studies on that. So someone who's not getting enough sleep, I think it's good for them to have some power naps during the day. But if someone is sleeping long period of time and they take a nap, we do see some increased health conditions, problems with that. So generally, a nap which is more than 1 hour is not recommended. Okay? So try to take, if you need to take a nap, a power nap, 15, 20 minutes, and early, not very late. Okay? I think with that, that's end of my discussion, and any question that you folks have.
Lots of questions. First one, settle argument in my house. Is there a certain temperature that you would suggest the bedroom to be when you're sleeping that will be
It should be comfortable.
Okay, good,
Okay.
not 65.
Well, if it is comfortable for you, yes, but generally it is not. Yeah. Yeah. Good luck to find that balance. Yeah. Yeah. But it should be cold. So comfortably cold and as dark as possible.
Can you speak more about the medications that affect sleep?
All right. So medications that impact the neurotransmitters, those chemicals which are responsible for wakefulness, and medications that impact on the neurotransmitters that are responsible for sleep. They are going to have the impact. So we're going to have alerting effect and sedating effect. If we use at the right time, we can use those the effects in our favor. So for example, a very common medication called trazodone is depression medicine. It's not for insomnia. One of the side effects is sedation. So if someone takes for depression in the morning, that's not the right time, right? So we're going to use that at bedtime. Okay? So someone take another, depression medication, let's say Wellbutrin or bupropion. We give for smoking cessation, we give for weight management, for focus, but they're taking at nighttime. It's an alerting medication, so that's not the right time. So we're going to take it in the morning. So generally, the depression medication, they are going to be REM suppressant. That's why, people with depression, with PTSD, they have the nightmares and a lot of vivid dreams. And once they start the medication, they say, yeah, my dreams are better. I'm not having vivid dreams because it suppresses. And once they stop it abruptly, they're going to have lots of vivid dreams. Blood pressure medicine, for example, propranolol, it suppresses melatonin. I never had a problem with insomnia. Now my doctor started the propranolol for my heartbeat issue, and I'm having problem with sleep. So it can suppress the melatonin. So similarly, the pain medication, for example, gabapentin. Generally, gabapentin increases the slow wave sleep. And it is also a medicine, for someone who have lots of restlessness in their legs, or they have anxiety, or they cannot stay asleep. So, that can be used. So they're going to have impact based upon the neurotransmitters for wakefulness or neurotransmitters for the sleep. And generally, acetylcholine, adenosine, the melatonin, we have the histamine, serotonin. These are the neurotransmitters which are targeted by these medications and impact the sleep.
Does that affect deep sleep if you're taking any of those?
So benzodiazepine does actually reduces the slow wave sleep. And generally, our slow wave sleep is going to be impacted by sleep deprivation, other health condition because of the disruptions. So there is no FDA or any validated medication to improve the REM or the slow wave sleep. Just treat the underlying condition, improve the sleep, and we would get actually a better sleep. Okay?
So I can't just crawl in bed and go to sleep because my brain won't shut off, so I have to have something to distract me. And so I was looking at the screen, and I've seen some things and heard some people talk about like different lights you can use maybe to get to that point. Or if I read, can I use my lamp light? Because if I just lay there in bed, I'll be up all night.
So during the daytime, just imagine yourself, you are on a highway. All right, so you're going 75, and if you're going to Dallas, you're going 90 miles per hour. And now all of a sudden, you need to get on a street. And you have no ramp. You just go ahead and then, it's going to take some time. That's what brain does. So we are utilizing our brain for all those activities, and boom, I just want to get in a bed, and I want my brain to shut down. It does not happen then. So there are different techniques. So one of the technique is basically the thought dumping. So during the daytime, get few minutes in between. Calm down. Let your brain to go slow. Okay? And then in the evening time, before you go to the bed, write down your thoughts. Okay, write down your thoughts. Okay, you know what? I have to do this thing or that thing, and I'm going to address that in the morning. So you're not going to miss anything. So brain would actually like that idea. So there is going to be a cool down effect before you go to bed, because we know bed is only for sex and sleep. It's not going to be a place to calm us down. Okay? If you need to read, yes, reading is okay, just perfectly fine. So we need to prevent the blue light. There are some filters, again, not clinically validated. Okay? So there's not, just have a dim light or at least the reading light behind you.
Oh, one more question. I've been hearing a lot of mixed things about like melatonin. What are your thoughts on melatonin? 'Cause
So-
I don't take that often.
Melatonin is actually prescription drug in Europe, but in United States it is not. And we really do not know how much quantity of melatonin is in given product. Melatonin is not necessarily for insomnia, but it is for the circadian rhythm. Okay, I think most studies are between 2 to 6 milligram. I have a patient who says I take 200 milligram or 100 milligram. You're just going to pee that out. Okay, taking it during the daytime when the light is out, it's not going to help, right? And then some studies, they say it may actually worsen the cardiac conditions. And the other study says, well, it helps. Okay, so for me, for right now, it's unsettled science. So there needs to be a bigger study, better study to suggest if melatonin is safe for the heart or not. But generally, the study which I have read, it shows it improves the cardiac function. So for insomnia, if someone needs to take melatonin, so do not take too much of the dose, 5 milligram, maximum 10, I would say, 5 to 6 milligram, and take it half an hour to an hour before you go to the bed. But if it is for the circadian rhythm, which means people, they are sleeping 3 a.m. and they're in a bed at 10, then take very low dose melatonin in the evening time. So light pushes the sleep, okay? Melatonin pulls the sleep. So where you are going to apply these forces is going to be important. Okay? You're going to apply light at bedtime, is going to push it. Okay? If you take melatonin a little bit earlier, it's going to pull. But if you take it a little late, it's going to pull on the other side. Okay? All right.
Is there anything over the counter, more herbal, that you think does help us sleep?
So all those nutritional and herbal medication, again, they're not recommended. So as a doctor, according to the ASM, I'm not going to recommend. Okay, and most of these products, they're going to end up into melatonin. Or we're going to use antihistamine like Benadryl, Tylenol PM, or those are the antihistamine. As we age, especially in elderly, avoid those medications. Okay. Here and there makes sense. Some people, they become a little bit hyper with the Benadryl. Some people, they do okay. But generally, there can be a period of grogginess during the day.
So I've heard that taking some of those drugs can affect memory. Is that
Yes.
true?
Yes.
Can you talk to that?
So now we're getting into a little bit more academics here. Okay. So the most common medications, let's say Ambien, okay, or Zolpidem, or the benzodiazepine like Restoril or temazepam, they work on a receptor in the brain which is called the GABA receptor. So our brain has the inhibition and the stimulation. The strongest stimulation is going to be the glutamate. That's of our, the cerebral cortex. So that's basically is going to be the ultimate thing that's going to keep us awake. And GABA, on the other hand, is the one that's going to put us to sleep. And we target the GABA during anesthesia for the pain, for anxiety. So there are different receptors for that. So these medications, they act on different receptors, and some of those receptors can also impact our memory. Okay? So they're going to cause the amnesia. So that's why there is an FDA black box warning, and I recommend all my colleagues to, when they prescribe these medications, make sure patients know that there is an FDA black box warning for using the Z drug, that you may have a complex sleep-related behaviors. I had one patient who said, in the morning I received a call from a stranger, thank you very much for dropping at 2 a.m. He said, I don't remember I was driving. Okay? So there is an amnesia, there is a sleep driving, sleep eating that can happen, and patients have no memory. These medications are not that good, not that safe in elderly, because that's going to increase their cognitive decline, that's going to increase their risk of fall, and we do not want that. All right.
Any other questions?
I work with teenagers, middle and high school students, and sleep is, they don't go to sleep. They have a screen. But what would you say to teenagers to encourage sleep? Like, are there risks for teenagers who do not sleep enough that potentially could convince them the importance of sleep?
I have 5 kids. I have 5 teens. They're all vampires. They are night owls. Okay? Their rooms are dark and 65 degree. And even they study, with a dim light. And they are awake at nighttime and then they sleep during the daytime. It's very common. And approaching teens, we have to be a little bit more creative. All right, so they're going to go with the positive reinforcement. So always believe in positive reinforcement and engagement. Like this discussion we have, I think we have more discussion about the importance of the sleep in the schools, in the colleges. ASM also promotes to adjust the school times. Okay, go for a little bit later times. Okay, most of the teens, they like afternoon classes or evening classes. Early morning class, my son, he hates that, and he generally misses those. And I don't blame him, because he's not going to sleep till 2 or 3 a.m. So there is going to be a sleep-wake habits issues. Again, try to narrow down the wake time. So some days I wake up at 6 a.m. and rest of the time is 3 p.m. All right, so that's a huge window. So try to narrow it down and do it slowly, 15, 20 minutes, all right? So in few weeks, they're going to come very close to that window, okay? And similarly, again, do not do your homework, do not play, do not use those phones when you are in the bed. If you enjoy it, do it outside the bed, okay? Similarly, the amount of sleep is going to impact their grades. If they're not sleeping good, they're not sleeping enough, their grade's going to go down. Their focus, their memory is going to be impacted. So that's another topic, we can discuss with the teens. Hey, you want to excel, you want to have a better brain function, let's focus on the sleep. And maybe having some incentives for that. Okay? Well, I'm going to eat out, so let's go ahead and do a sleep diary, sleep journal. See how many hours of sleep you're getting. So those are just the general tips, I would say. All right.
Very good. Everyone, will you please give a round of applause to Dr. Maqsood?
Thank you.